identifying the signs of OCD as a parent can in fact be tricky because some of the symptoms are in fact observable. So for example, if a child is taking excessively long showers or washing their hands repeatedly, or, have other superstitions or rituals at nighttime, some of those behaviors are in fact observable. But then there are also some of the obsessional thinking, or even sometimes the hidden compulsions, the sticky thoughts where they're stuck in their head and they're trying to undo their thoughts in a way that's sort of what we might call mental compulsions or neutralizing. They're still compulsions because they're still behaviors aimed at getting rid of the thoughts, but they can sometimes be less overtly kind of observable. If things are taking an unusual amount of time, or if you are noticing that a child is engaging in a repeated behavior that seems nonsensical, or if you are hearing requests to do things in a certain way or to do them over and over again, even as a parent, these may be signs that there's some type of worry thought that is underneath it. So for example, nighttime, which tends to be a ripe time for OCD symptoms to be sort of more flared up. The goodnights, you might have a child that'll say, no, you have to say goodnight to me last, or you need to turn off my light and then you need to say goodnight. And oftentimes parents might sort of kind of do this, and then they notice that it's a pattern. They notice if they attempt to switch it up, it's more than just mildly irritating. It can be incredibly distressing. So what I will tell parents is not every routine means your child has OCD, or not every question or request, or frankly, even a shower that one time might take a little bit longer, that doesn't mean it's OCD. It's a pattern of behavior. And it's when you start to notice that some of these repeated behaviors or the distress associated with their thoughts or complaints about sticky or unwanted thoughts are increasing, these might be signs that there may be a diagnosis of OCD that needs to be looked at further.